Hey everyone, welcome back to all my listeners. This is episode 15 of season 10. Today is Wednesday, December 13th, 2023. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, let's go ahead and dive into today because you know what it is. It's the second Wednesday of the month, and I'm going to be getting into the November 2023 OIG Work Plan in today's Newsworthy. And there are a whopping 15 work plan updates. And in my Trusty Tip, I wanted to go over compliance initiatives for the new year ahead. And of course, I go ahead and close out and round out today's episode with a remarkable quote on perseverance by Maya Angelou. This episode is sponsored by Utilization Management University. Let's get into it. Whether you are involved in the business of healthcare or any other business, what do you, your teams, and your management concentrate on the most? Typically, they communicate, problem solve, and make strategic decisions that drive the success of the organization. But how much time is actually spent in making tomorrow better than today? Are they striving for operational excellence? Prevention versus correction is a concept that's been known for years. So why do so many companies not implement the process? Utilization Management University provides a course that proves to be a unique solution to instill change in the mindset of business teams. This course provides the theory and the practical approach. This course will demonstrate how to implement a simple methodology as a solution. This course provides a detailed explanation of each and every step involved in prioritizing your problems and finding the root cause. This course shows how to engage team buy-in. This course readily provides available support for any issues. And the course provides the theory and helps you adapt it to your own individual circumstances. Check out the details at www.utilizationmanagementuniversity.com today and get registered. Utilization Management University, making tomorrow better. So let's get into Newsworthy, the month of November's OIG Work Plan updates. There are 15 updates to the OIG Work Plan for the month of November. The first OIG Work Plan for November 2023 is titled Medicare Payments Compared to the Prices Available to Consumers and Suppliers for Continuous Glucose Monitors and Sensors. Now, this report is coming from the Office of Evaluation and Inspections. The OIG will compare Medicare payments to suppliers' acquisition costs and prices otherwise available to consumers for selected continuous glucose monitors, or CGMs, and their sensors to determine if there are potential cost savings for Medicare and enrollees. In 2022, Medicare Part B allowed more than $1.1 billion in payments for CGMs and sensors. If the OIG finds that Medicare payments for CGMs greatly exceed their acquisition costs, then CMS has the authority to adjust payment rates for CGMs and sensors through two methods. Method 1, CMS can adjust the fee schedule prices using its inherent reasonableness authority. Or 2, CMS can also introduce an item into the Medicare Durable Medical Equipment, Prosthetics, Orthotics, and Supplies Competitive Bidding Program. This final report is expected in fiscal year 2025. The second OIG Work Plan for November 2023 is titled Assessing the Alaska Foster Care Agency's Compliance, Challenges and Successes When American Indian and Alaska Native Children Go Missing from Care. Now, this report is expected from the Office of Evaluation and Inspections. American Indian and Alaska Native, or AI children, are disproportionately represented among missing children and are more likely to go missing from a foster care placement than any other location. When children go missing from foster care, they may experience serious negative consequences, including a heightened risk of human trafficking, as well as poorer outcomes related to health, safety, education, employment, and subsequent criminal justice system involvement. Now, for these Alaska Native children who went missing from Alaska's foster care system in Alaska. This evaluation will review foster care case files and related documentation to determine whether Alaska complied with federal and state rules before, during, and after the children went missing from care, or attempted to locate the children while they were missing, provided children with services after they returned to care. This study will also examine whether Alaska involved children's tribes throughout this process and attempt to gain perspectives from both the state and the tribes about challenges and successes in these cases. This final report is expected in fiscal year 2025. Now, the third OIG Work Plan update for November 2023 is titled Comparison of Average Sales Prices and Average Manufacturer Prices, Results for the First Quarter 2024. Now, this report is expected from the Office of Evaluation and Inspections. When Congress established average sales price, or ASP, as the basis for Medicare Part B drug reimbursement, it also provided a mechanism for monitoring market prices and limiting potentially excessive Medicare payment amounts. Section 1847A D 1 through 3 of the Social Security Act mandates that the Office of the Inspector General, the OIG, compare ASPs with average manufacturer prices, AMPs, and the widely available market price, if any. If the OIG finds that the ASP for a drug exceeded the AMP by 5% in the 2 previous quarters or 3 of the previous 4 quarters, the Secretary of Health and Human Services may substitute the reimbursement amount with the lower calculated rate. This quarterly update summarizes the results of OIG's comparison analysis based on ASP and AMP data reported for the first quarter 2024. The update specifically reports the number of drugs the OIG identified that met the criteria for substitution of a lower reimbursement amount. This final report is expected in fiscal year 2024. The fourth OIG Work Plan update for November 2023 is titled Comparison of Average Sales Prices and Average Manufacturer Prices, Results for the Second Quarter 2023. Now, this quarterly update summarizes the results of OIG's comparison analysis based on ASP and AMP data reported for the second quarter 2023. This update specifically reports the number of drugs identified by the OIG that met the criteria for substitution of a lower reimbursement amount. This final report is expected in fiscal year 2024. Now, the fifth OIG Work Plan update for November 2023 is titled Comparison of Average Sales Prices and Average Manufacturer Prices, Results for the Third Quarter 2023. Now, this quarterly update summarizes the results of the OIG's comparison analysis based on ASP and AMP data reported for the third quarter 2023. This update specifically reports the number of drugs OIG identified that met the criteria for substitution of a lower reimbursement amount. This final report is expected in fiscal year 2024. And the sixth OIG Work Plan update for November 2023 is titled Comparison of Average Sales Prices and Average Manufacturer Prices, Results for the Fourth Quarter 2023. Now, this report is coming from the Office of Evaluation and Inspections. This quarterly update summarizes the results of the OIG's comparison analysis based on ASP and AMP data reported for the fourth quarter 2023. This update specifically reports the number of drugs the OIG identified that met the criteria for substitution of a lower reimbursement amount. And this final report is also expected in fiscal year 2024. Now, the seventh OIG Work Plan update for November 2023 is titled Case Study, Preparedness and Response for Disruptions in Healthcare in Select Communities During and After Hurricanes Fiona and Ian. This report is coming from the Office of Evaluation and Inspections. In 2022, Hurricanes Fiona and Ian made landfall as Category 4 hurricanes, resulting in more than $115 billion in damages and causing the deaths of more than 170 people. In Puerto Rico, Florida, and South Carolina, several healthcare facilities such as hospitals, end-stage renal disease facilities, and community health centers experienced disruptions in services caused by factors such as power outages, water shortages, and/or staffing shortages. This study will describe specific disruptions in healthcare during and after Hurricanes Fiona and Ian for select communities in Puerto Rico, Florida, and South Carolina. The OIG will determine how and the extent to which select communities prepared to prevent these specific disruptions, as well as how Puerto Rico, Florida, and South Carolina oversaw and supported communities prior to the hurricanes. The OIG will determine how and to what extent select communities addressed these specific disruptions during and after the hurricanes, as well as how Puerto Rico, Florida, and South Carolina oversaw and supported these response activities. OIG will examine HHS's support and oversight of Puerto Rico's, Florida's, and South Carolina's compliance with meeting performance measures and standards for healthcare preparedness and response. The OIG will also assess which HHS resources were used for both preparedness and response activities, and whether any relevant resources were used and why. Were not used and why. This study will help improve how HHS and states oversee and support public health and healthcare delivery systems in preparing for and responding to public health emergencies, including hurricanes. This final report is expected in fiscal year 2025. Now, the 8th OIG Work Plan update for November 2023 is titled Medicare Part B Drug Payments, Impact of Price Substitutions Based on 2022 Average Sales Prices. Now, this report is coming from the Office of Evaluation and Inspections. When Congress established average sales price, ASP, as the basis for Medicare Part B drug reimbursement, it also provided a mechanism for monitoring market prices and limiting potentially excessive Medicare payment amounts. Section 1847A D 1 through 3 of the Social Security Act mandates that the Office of the Inspector General, the OIG, compare ASPs with average manufacturer prices, AMPs, and the widely available market price, if any. If the OIG finds that the ASP for a drug exceeded the AMP by 5% in the 2 previous quarters or 3 of the previous 4 quarters, the Secretary of Health and Human Services may substitute the reimbursement amount with the lower calculated rate. Over the past decade, the OIG has produced annual reports aggregating the results of their mandated quarterly ASP to AMP comparisons. This annual report will quantify the savings to Medicare and its patients that are a direct result of CMS's price substitution policy based on 2022 ASPs, and may offer recommendations for Medicare to achieve additional savings. This final report is expected in fiscal year 2024. Now, the 9th OIG Work Plan update for November 2023 is titled Medicare Part D Formulary Coverage for Humira Biosimilars. This report is coming from the Office of Evaluation and Inspections. Humira is one of the best-selling prescription drugs in the world and one of the most costly drugs for the Medicare Part D program. It faced its first competition in the United States in 2023, ending nearly 20 years of market exclusivity. Launches of multiple biosimilars for Humira in 2023, including one interchangeable version, have presented an opportunity to increase access to lower-cost drugs and ultimately significantly reduce Part D drug spending. However, a lack of Part D formulary coverage for Humira's biosimilars or preferential formulary placement for Humira could limit the wider use of these biosimilars, as well as limit any potential spending reductions for the Part D program and its enrollees. This OIG study will determine how often Part D formularies covered Humira's biosimilars after they became available and describe differences in cost sharing or utilization management requirements, as well as list prices for Humira and its biosimilars. This final report is expected in fiscal year 2025. 2025. Now, the 10th OIG Work Plan update for November 2023 is titled Audit of Emergency Preparedness, Infection Prevention and Control, and Life Safety at Intermediate Care Facilities for Individuals with Intellectual Disabilities. This report is expected from the Office of Audit Services. An intermediate care facility for individuals with intellectual disabilities, or the ICF or IID, is an institution that provides health and or rehabilitation services to individuals with intellectual disabilities under the Medicaid program. Now, the ICF IID services are covered by Medicaid when they are provided in a residential facility licensed and certified by a state survey agency as an ICF IID. Medicaid covers ICF IID services for more than 100,000 individuals with intellectual disabilities and other related conditions. ICF IIDs face significant challenges in the event of emergencies such as fires, emerging infectious disease outbreaks, and natural disasters. Previous OIG audits on infection prevention and control, emergency preparedness, and life safety at nursing homes identified multiple issues that put Medicaid enrollees at increased risk. The OIG's objective is to determine whether selected states' ICF IIDs complied with federal requirements for infection prevention and control, emergency preparedness, and life safety. This final report is expected in fiscal year 2025. Now, the 11th OIG Work Plan update for November 2023 is titled Audit of Nursing Homes Nurse Staffing Hours Reported in CMS's Payroll-Based Journal. This report is coming from the Office of Audit Services. Nursing homes are required to electronically submit complete and accurate direct care staffing information to CMS's Payroll-Based Journal, or PBJ, system on a quarterly basis. Direct care staff include nurse and non-nurse staff who, through interpersonal contact with nursing home residents or resident care management, provide care and services to residents to allow them to attain or maintain the highest practicable physical, mental, and psychosocial well-being. CMS and other stakeholders use the staffing information in the PBJ to do these four things. Number one, to measure nursing home performance. Number two, to better understand the relationship between nursing home staffing levels and the quality of care that nursing homes provide. Number three, identify non-compliance with federal nurse staffing regulations. And finally, fourth, to facilitate the development of nursing home staffing measures. The OIG will review the nurse staffing hours reported in the PBJ to determine whether the reported hours are accurate. This final report is expected in fiscal year 2025. Now, the 12th OIG Work Plan update for November 2023 is titled Medicare Part C Audits of Documentation Supporting Specific Diagnosis Codes. This report is coming from the Office of Audit Services. Payments to Medicare Advantage, or MA, organizations are risk adjusted based on each enrollee's health status, pursuant to the Social Security Act, Section 1853A. MA organizations are required to submit risk adjustment data to CMS in accordance with CMS instructions. And inaccurate diagnoses may cause CMS to pay MA organizations improper amounts. In general, MA organizations receive higher payments for enrollees with more complex diagnoses. CMS estimates that 9.5% of payments to MA organizations are improper, mainly due to unsupported diagnoses submitted by MA organizations. Prior OIG reviews have shown that some diagnoses are more at risk than others to be unsupported by medical record documentation. The OIG will perform a targeted review of these diagnoses and will review the medical record documentation to ensure that it supports the diagnoses that MA organizations submitted to CMS for use in CMS's risk score calculations and to determine whether the diagnoses submitted complied with federal requirements. This final report is expected in fiscal year 2026. Now, the 13th OIG Work Plan update for November 2023 is titled Audits of Medicare Part C Health Risk Assessment Diagnosis Codes. This report is coming from the Office of Audit Services. Payments to Medicare Advantage or MA organizations are risk adjusted based on each enrollee's health status, pursuant to the Social Security Act, Section 1853A. One tool that MA organizations use to collect risk-adjusted data is the Health Risk Assessment, or the HRA, which gathers information about enrollees, including health status and health risks. MA organizations are required to submit risk adjustment data to CMS in accordance with CMS instructions, pursuant to 42 CFR Section 422.310b. And inaccurate diagnoses may cause CMS to pay MA organizations improper amounts. For these audits, the focus is on enrollees whose diagnoses, reported only on HRAs, mapped to a hierarchical condition category and resulted in increased risk-adjusted payments from CMS to MA organizations. The OIG will determine whether these diagnosis codes, as submitted by MA organizations to CMS for use in CMS's risk adjustment program, complied with federal requirements. This final report is expected in fiscal year 2025. Now, the 14th OIG Work Plan update for November 2023 is titled Audit of the Background Verification Process of Commissioned Corps Officers Assigned to Tribal and Indian Health Service health programs. This report is coming from the Office of Audit Services. The United States Public Health Service Commissioned Corps is a branch of the nation's uniformed services committed to the service of public health. Commissioned Corps Officers, or CCOs, advance the nation's public health by serving in agencies across the government as physicians, nurses, dentists, scientists, engineers, and other professionals to fight disease, conduct research, and care for patients in underserved communities across the nation and throughout the world. CCOs may be assigned to the Indian Health Service, or IHS, which can place a CCO at tribal or IHS health programs. The Indian Child Protection and Family Violence Prevention Act requires background investigations, including Federal Bureau of Investigation, or FBI, fingerprinting for individuals whose duties involve contact with children. Federal regulations require periodic reinvestigations of CCOs. Prior OIG audit work identified that federal employees assigned to tribal and IHS health programs did not always meet federal background investigation requirements for individuals in contact with American Indian children. The OIG will determine whether CCOs assigned to provide healthcare services to tribal and IHS health programs received background investigations and reinvestigations in accordance with federal requirements. This final report is expected in fiscal year 2025. Now, the 15th and final OIG Work Plan update for November 2023 is titled Audit of the National Institutes of Health, the NIH's, efforts to ensure a safe and respectful workplace. Now, this report is expected from the Office of Audit Services. The 2022 Consolidated Appropriations Act mandated that the NIH director to require NIH-funded institutions to report to the NIH, quote, when individuals identified as principal investigator or as key personnel in an NIH notice of award are removed from their position or are otherwise disciplined due to concerns about harassment, bullying, retaliation, or hostile working conditions, end quote. The NIH expects recipient institutions to have policies and practices in place that foster an environment free from harassment and other forms of inappropriate conduct that can result in a hostile work environment. NIH recipients should provide safe and respectful working conditions for their employees to foster work environments that promote innovation by leveraging different backgrounds, experiences, and points of view. The OIG will determine, number one, whether the NIH has implemented the federal requirement for NIH-funded institutions to report individuals who have been removed or disciplined due to concerns about harassment, bullying, retaliation, or hostile working conditions. And finally, second, how the NIH has used the reported information to improve work environments and promote a diverse workforce at NIH-funded institutions. This final report is expected in fiscal year 2025. And now, it's time for my best practice tips in Trusty Tip. 2024 is just around the corner, and practices big and small should be drawing up blueprints for their own compliance initiatives. Remember, the OIG just issued their overhaul of the CPG's Compliance Program Guidances. They issued the General Compliance Program Guidance in November, and I just discussed it a few weeks ago in Season 10's Episode 11. But in today's recommendation, in today's Trusty Tip for your best compliance initiative for the new year is to start drafting your own written policies and your own written procedures for your individual service lines. Give yourself that holiday gift this year and wrap it up with a bow. Develop your own written code of conduct and written compliance policies because they're critical elements of any compliance program. The compliance program should also require that all of your entity's policies and procedures incorporate a culture of compliance into your day-to-day operations. This code of conduct and compliance policies and procedures should be developed under the direction and supervision of a compliance officer that you've appointed, as well as an entire compliance committee. And it should be made available to all of the relevant folks, those individuals within your organization. Now, compliance with the Code of Conduct and all applicable policies and procedures should be part of the performance evaluations of all of your employees, as well as all of your contractors. Because remember, there are some very common compliance risky areas that the OIG has identified. And those include billing, coding, sales, marketing, quality of care, patient incentives, as well as arrangements with physicians, other healthcare providers, vendors, and other potential sources or recipients of referrals for your healthcare business. Include these crucial risky areas into your written policies and procedures to help highlight the culture of compliance that you've developed for your practice. And finally, I focus Season 10's Spark on perseverance. I want this 10th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who's inspired the need for perseverance in all we strive to do. So, in this week's inspiring quote in Spark is from Maya Angelou. You may encounter many defeats, but you must not be defeated. In fact, it may be necessary to encounter the defeats so you can know who you are, what you can rise from, how you can still come out of it. Absolutely true, right? This quote reminds us that we can never be defeated. This quote reminds us that each defeat is required so we can rise up. This quote encourages us to stand tall after each setback. This quote encourages us to challenge ourselves to find our eventual success through our perseverance. I'm happy Maya Angelou's spark still burns brightly in all of us today. So that wraps up today's episode, and as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. So, in my final note, the weeks of 2023 are quickly winding down, you guys. Just a few more weeks left and the year is over. So I hope you're all making plans, dreaming up your vision boards, and setting your intentions for what you want your 2024 to look like. I know I'm looking forward to all I have in store for my 2024. Now, I wish you guys all an amazing and incredible and very happy week ahead. Thank you guys so much for listening on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.